as an organization, health and well-being for staff is important, and I think it translates even to our borough level. One of the things that we starting actually in Havering, it's been going on before the pandemic, but we lost part of that, is actually to have listening sessions for staff. So this is a surgery where all the senior people within my directorate, they just sit in a room and listen to staff. We do also have some psychological support for staff whenever they feel the need to talk to someone and get that support without actually, going and being in a waiting list or anything like that. They get that promotion and they get through that through our IAP services.
I think the Trust has done a great job with the emotional well-being of staff, and just made it open to every single person. So whether I recall I was talking to a gentleman in IT who was feeling a bit isolated, and I was able to point him in the right direction of going to the emotional health and wellbeing line for support. Locally, we will try anything in Havering. Innovation is what we like to do. So when the weather was slightly better, we had Wellbeing Wednesday walks where we'd all march around the local borough, having a walk, having a chat, and everybody getting together. And we've done things where we'll have a month of bring your own lunch on a Wednesday, and we'll all stop in the office and put some music on and eat our lunch at our desk. Just that kind of stuff that enables people to actually stop and switch off.
So in terms of improving quality and innovation, we've had so many sort of schemes that we've been doing. Currently, we are working on a big transformation program for mental health. This is just looking at how can we improve quality, but how is that being done? I guess it's really that co-production, working with service users and frontline staff to make sure that any models or any changes in care that we are trying to achieve in terms of changing that quality, it's co-produced and it's co-owned by the people. So that's really one of the things we are doing. We know currently at the moment that we have problems in our risk assessment and care planning processes, and we've started a program in which we are working with our frontline staff to make sure that they are all upskilled, one in terms of training, secondly in terms of our risk management and risk assessment skills, they are all up to speed with that. So that in the long run will tend to improve on quality and safety of the service users that we are looking after.
We've had a lot of opportunities and innovation in Havering, and we recently had an away day with carers and service users to listen to their views about what we were doing well and what we were not doing well and what they would like their services to look like. And we felt that had to be the place that we start. You can't have a group of professionals sitting in the room again saying, oh, we think this is what the pathway should look like. You need the patients and their carers to tell you what worked and what didn't work, and then design the pathways with them. We quite often see carers as experts, but a lot of the feedback that we got from our carers is we're not experts. We actually need some training too. Another innovation for Havering is that we are the only area of the Trust that actually has a dedicated carers lead. And this is a clinical nurse specialist who, where families are struggling or carers are struggling, then our clinical nurse specialist supports them as part of the treatment program for their loved one.
In Havering, what we do is we've run service user forums. So those forums, they run on a periodical basis where we get to actually chance and an opportunity to just listen. The services we are providing, how are they to you? What does good look like to you? Because you're the one receiving our services. And those have been really very popular with the service users. And they've been informative in us in terms of sort of giving us a steer in the direction where we should be shaping our services to meet the needs of those who are receiving our services.
We had a case recently where somebody struggled with their mental health and their physical health, namely diabetes. So we were able to get 2 specialists from within our own organisation to do online training, which we videoed. I think we had 92 people attended, and then we were able to circulate that afterwards as a video link for everybody in the directorate across all of the different directorates. And we also sent it to our training department so it could be used as the trust induction and also use it as a local induction, because you have great innovation and lessons learned if you're at the meeting, but there is so much great knowledge out there that the trust has really adapted to being really innovative and making all of these available through training and development so we can induct and everybody can learn, not just if you were there on the day.